welcome to A Closer Look. Today we're going to be talking about the Chesapeake Care Clinic, and joining me today is Mary Ellen Remick, President of the Board. Welcome.
Thank you very much for having me.
So tell me about the clinic and who does it serve?
The clinic is located on South Military Highway, about a half a mile or so south of where the old Kmart was. And we serve anybody now in the entire Hampton Roads area who has an income of 300% of poverty, federal poverty level or less, and does not have insurance. We provide medical, dental care, some behavioral medicine, just a little, medications. We help with medications. So that's primarily what we do, but it is now for the entire Hampton Roads area. Initially, it was just for the Chesapeake area, but when Chesapeake Regional, who's a big supporter of us, became regional, we decided to expand to the entire Hampton Roads area.
Okay, that's great. So it's full service.
We try. We have a lot of subspecialties that support us.
So the services that are provided, you mentioned like dental and pretty much like vaccinations, that kind of thing, or immunizations?
We do some vaccinations because we try not to duplicate services provided by other agencies. Many vaccinations are provided by the health department, but we will do the flu vaccination because that's an important one and difficult for people to get. And we'll see what happens with COVID. I wouldn't be surprised if we end up doing the COVID vaccine too.
Definitely. So with COVID, speaking of COVID-19, how has the clinic adapted?
What the clinic has done is move to as much online as they possibly can. They're doing telemedicine. We are providing patients that have chronic hypertension with their own blood pressure cuffs, so the nurses can call them, what's your blood pressure doing? And they can adjust as necessary. We do the same for diabetics. We provide them with glucometers so that they can check their blood sugar levels to make sure that they're okay. And again, a lot of these things can be done on the phone. Dental, there's no way around it. You have to come in for
Unfortunately,
dental.
you have to be there in person, right?
But we've had to scale back to just emergencies right now because the dentist couldn't come in. And then the dentist had to reopen their office and make up for what they had not been able to do for a couple of months when they were closed down. So right now we are trying to scale back up with dental, but we haven't been able to do a lot yet. So we're looking for dental volunteers. We're always looking for volunteers. It is a much more expensive service to provide.
Sure.
So unfortunately, we have to charge a little bit more for it, but it's still considerably less than what would be in a private practice. It's $30 for whatever we can get done in an hour.
That is amazing.
That's pretty good.
That really is, because I know a lot of people, maybe even lower income, would think that's not something they could afford.
Exactly. We can do dentures, but we don't have a limited amount of dentures that we can do because of the supplier. But we are trying to increase that also.
So what type of annual services are provided, say mammograms or any other type of exam someone may need to have on an annual basis?
Well, a woman in particular does need an annual mammogram. Anybody over the age of 40 should have an annual mammogram. And pap smears are done about every 5 years now when they're normal. We do provide that. We have a grant from the federal government called EWL, or Every Woman's Life. And through that, we are able to provide pap smears and mammograms through Chesapeake Regional. They do our mammograms and our pap smears for us. It's a really wonderful service, and we have several good physicians in the area who follow up when there's an abnormality in there. And then if it does turn out to be cancer, we usually send them to Virginia Oncology, who's also very good to us.
So it's nice to know that someone doesn't have to put that off, something that's so important and can be prevented in a lot of cases.
Absolutely. Absolutely. We also can do some colonoscopies. There's some gastroenterologists in the area who will do a certain number for us each month.
Okay, so great. So someone can go and find out what exams are available through the website as well. Okay.
Exactly. The medications I think are very interesting. We have nurses that are amazing at being able to find the cheapest source of a medication for a patient. We have pharmacists on staff who always change the medications around so they have the generic that are much cheaper. We also are affiliated with a group in Richmond. I believe it's RX, something RX. Anyway, but they supply us with generics, I think it's about 50 of the most common generics. And for this, we can give a patient a 1-month supply of medication for $2 and
great.
a 3-month supply for $5.
That's great.
It is. It's amazing help for the patient. We are able to supply insulin for $5 a month, which
that's great.
is about $5,000 a month on the pharmacy.
How many patients would you say you treat or see within a month or the past year? Or
It is varied quite a bit since Virginia decided to keep take the Medicaid expansion. About 2/3 of our patients moved to Medicaid, which we actively encourage them to do and help them to do because it is a better deal for them. So at the moment, we have probably, I think, 600 or 700 patients, but we have room for much more.
Oh, that's great.
So we are actively trying to get the word out that we're available. With so many people losing their jobs and often their
Right.
health insurance with COVID, we want them to know we are here to help. And we are understanding that because we've moved from the Medicaid patient who was really very, very poor to the 300%, which are struggling for sure, but frequently employed, we have to change our approach a little bit. We've been working hard on doing that.
so how would someone know if they qualify?
Well, they have to be 300% of poverty. You can look up poverty
Right.
online. But in general, for a family of 4, 300% of poverty is about $77,000 a year. It sounds like a lot. It's not.
Not
if
for
you're-
that many people.
Not for that
under
many
the roof.
people. So they have to have that. That's really the only thing. The only thing, we can't serve anybody in North Carolina because we get state funds.
Right.
But anybody in Virginia, if they want to come from the western part of the state, we'll
Really?
see them. Yes. I don't
That's
know why they want to
great.
do that, but
Well, that's really great that you reach a lot of people and that people are welcome to come in.
yes, very much so.
Now, do they need to schedule prior or call you? How do they need to set
We
up an
have
appointment?
a procedure called an eligibility procedure, which you can do online now.
Okay.
And they can supply us all the paperwork and online, and then we get them in for their first appointment and see what kind of health needs they have and try to arrange for them, or arrange to meet their health needs. We have a lot of subspecialty. We have someplace in the area of 120 physicians in this area
Really?
that either come into the clinic and provide services, but many of them, especially the subspecialists, will see our patients in their office at no charge.
Yeah, I was wondering how that worked, how you were able to accommodate, like within the building, or if you were at all in the building.
Right.
Some you are.
Some we are, but many of them we send out. We have some very, very generous physicians in this area.
That's great.
That do wonderful work for our patients.
That's great. Now, what new projects are on the horizon?
Well, we are currently doing 3 things. One of them is our medical area was first built in 1992 and is not adequate right now. It does not meet HIPAA. It does not meet ADA compliance, and doesn't even have sinks in the bathroom, in the rooms. The rooms are tiny and hard to work around. So we have a project going on where we're going to renovate this, and it hopefully will start soon. We have already decided on a contractor who's been, again, very generous to us. It's a company called RRMM Design Build. They helped us with our last expansion and the dental expansion, and they are doing this medical renovation, and they are very good to us, very good to us.
Great.
Another project we have is we are working with Montero Medical Missions. Dr. Montero was the original physician who started Chesapeake Care, and right now he is working hard with veterans to get them dental care. So they have joined with us to provide veterans who meet our eligibility requirements dental care, and they are paying for the first visit for their care at the clinic. Because we're so short on dentists, they are also hopefully going to help us hire a dentist, which would
Okay.
be wonderful if we could make that happen. And the third project is we are in the process of renovating the outside of the clinic. We took out all the bushes last Saturday, so it looks pretty bare right now. But we are working with master gardeners to make a area that is all native plants, and hopefully will be a project that they can show other people about using native
Wonderful.
plants in the area. Those are our three
That's
big projects
great.
going
That
on
sounds
right
like
now.
you got a lot going on. Definitely.
I
In the
feel like
middle
we have
of
a lot of balls in
pandemic,
the air
and during
right
a
now.
pandemic is great. Now, how can someone support the clinic?
Well, always money.
That's what I would imagine.
We can always money. We have a staff of, I think, 3 full-time and several part-time professionals. They have to be paid, obviously. We have to buy the medicines. We have to, provide the equipment that needs
Right.
to be done. We are working very hard to keep our area very COVID safe. We have HEPA filters now in all the dental areas, and they're portable, so we can move them into other areas if we need a HEPA filter. HEPA filter is something that will take out the viruses out of the air.
Okay.
And it really does provide for a very safe area from an air point of view. Our dental clinic is very, very impressive. It is pretty much state of the art, which is
Nice.
kind of surprising for a
Right.
clinic of our type. But it is, and we've got 5 chairs, and so it has a lot of potential. Has a lot of potential.
So when you say they can support the clinic through monetary means,
Sure.
is there a specific way, or do you guys
Well, go
have-
online. We have a
Sure,
website, and you
okay.
can donate through that. We have our fundraisers. You can certainly help us with all that, and we're trying to make those COVID safe also. Right, and volunteers.
Okay.
Dental volunteers are ones we definitely need right now. Dentists, dental hygienists, dental assistants. All of those we could really use. We can always use everything.
Right.
We always find something for
So
everything.
basically, go on to the website and,
Right.
and check out.
Right.
And I checked it out as well. And there's a lot of information out there
There is. There's a lot
as
of
far as
information.
services and how you can help as well.
Yeah.
So great. Well, thank you so much for coming on to talk about the Chesapeake Care Clinic.
And I
We
very much
appreciate
appreciate
it. Sounds
you
like
having
you're doing
me.
wonderful things.
Thank you.
Thank you.
It's very wonderful people helping us.
Yeah, sounds like it. Thanks so much for joining us on this edition of A Closer Look, and we'll see you next time.